Welcome back, and it's great to have you here on WKYT. Heart disease is almost entirely preventable, and some lifestyle choices and conditions increase the risk.
Dr. Gretchen Wells and Joey Maggard are here, and we have heard that heart disease is the #1 killer of women. I don't think a lot of people really know that. You know, what are there things that we can do to cut down on that risk?
Yes, absolutely. First of all, be aware of your symptoms.
Are the symptoms different for women?
Absolutely, they can be. Many women will experience the typical Hollywood heart attack of the chest pressure, but some women it's a bit more subtle. Symptoms such as fatigue, nausea, jaw discomfort, shortness of breath, not feeling right, even confusion. But mainly it's when something is just not right. You should be alert to those and get those checked out.
And what about, you know, from a preventive standpoint, realizing ahead of time, living a better lifestyle can keep some of this from happening?
Absolutely. As you said earlier, we know that most of this is preventable, and some of the larger studies have shown, in fact, this about 96% is preventable, okay? Things such as daily exercise. For women who walk briskly just 30 minutes, 5 out of 7 days a week, reduce their risk of a heart attack by 50%. No smoking, knowing your numbers, controlling your cholesterol, your blood pressure, your blood sugar. There are lots of things that we can do to reduce our risk.
Joey, I think the American Heart Association has done such a good job trying to get the word out about this. Are we making a difference? Are there things that people need to keep in mind right now?
I think the big thing that I try to stress as well is that when you go to see your physician, for ladies, talk to them as much about your heart as you do any other part of your body. You know, my wife is one of 3 girls, my mother-in-law was one of 2 girls, and they all had in their mind that breast cancer was their largest health risk, when in fact 10 times more women die of heart disease as breast cancer. So really talking with your medical professional, following those lifestyle changes that Dr. Wells recommended as well. And I think we are making progress, Barbara, I really do.
That's good to know, and an important distinction to know that there is that disparity between men pay a little more attention to this.
Yeah, we actually lose more women to heart disease here in Kentucky than men. So,
Good reminders. I'll have a different conversation with my doctor the next time I'm there.
There we go.
Thanks for being here.
Thank you all for